Hello and very good evening, all of you. I'm Sayukta from Radiance with You YouTube channel, and I'm sure all of you must be doing really good. Today, we are talking about the essential role of moisturizers in managing dry skin disorders like eczema, psoriasis, or simple dryness. If you're struggling with dry skin, you're not alone. Moisturizers are key to keeping your skin healthy and comfortable. Now, dry skin happens when your skin loses moisture and can't retain enough water. This leads to rough, flaky, and sometimes itchy skin. Conditions like eczema or psoriasis make this even worse by damaging the skin's natural barrier. We are going to have an important chat about them and how we can stop them from spreading by taking action early. So don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it. We'll look at how to manage dry skin from happening and talk about the latest, things that are available to treat it. So let's connect today with our skin expert, Dr. Seema Srinivas, MBBS, MD, Dermatology, Director of Spandana Hospitals Private Limited, Bangalore. Throughout her career, Dr. Seema Srinivas has contributed significantly to the field of dermatology. Her commitment to advancing the understanding and treatment of various skin conditions is evident in her extensive body of work. She is joining us live from Bangalore and she'll talk about moisturizer's role on dry skin disorders. And with nearly a decade of experience and offering world class dermatological care to all her patients suffering from various skin disorders or diseases, it's such a pleasure to have you with us, Dr. Seema Srinivasa. A very warm welcome to you.
Thank you so much, Sayukta. You've been very generous and kind with the appreciation and with introducing me. I really hope I'm able to contribute a little bit more with all the questions and doubts that the audience have, or the common misconceptions that we have in and around moisturizers. I'm able to solve a little bit of their problems.
We are really looking forward to this session, doctor, because dry skin is something, even if it's winter and most of us in various parts of India are experiencing winter and the problem of dry skin, but then we know that even during summers or the other seasons, because of these air conditioners, etc., our skin do turn dry, and it's such a difficult thing to deal with, even if the solution looks so simple, which is a moisturizer. So we'll try to understand more about it. But to start with, doctor, what are the common causes of dry skin? Why at times, our skin turns very itchy, flaky, and dry?
Okay. So, dry skin, or also known as xerosis, that's what we as dermatologists call it, can be either localized or it can be generalized, right? You can have dry skin only for certain parts of your body, like your hands can be very dry, or your legs can be, feet can be very dry, elbows and knees can be extremely dry. But there are other parts that are, oily, especially the face can be very oily. But there are others who also suffer with generalized dry skin. They can have dryness all over the body. And for this, there are various reasons why one can experience really dry skin, either localized or generalized, right? So, the first and foremost reasons are your environmental factors. In environmental factors, you have your main weather, especially cold weather, that is working against you. Whenever there is cold weather and you end up taking very hot showers, it strips off your natural moisture and that can cause dryness. Other than that, we also have low humidity, where we have people working in offices for 8 hours, 10 hours, sitting in ACs, which can really reduce the moisture content in your body and cause really excessive dry skin. Then you have your excessive exposure to sun rays, your UV rays. You get burnt, you can have really dry skin. That is your environmental factors. Then you come to something called as lifestyles. In lifestyles, there are some things like using very harsh chemicals or harsh soaps. You end up using a lot of products because over the counter a lot of products are available. Nobody tells you whether it is good or bad for your skin, and you end up using these products, leading to excessive dry skin. There's also overwashing. You know that our environment is so polluted. You end up having frequent baths. You have bath in the morning, you come back from work, you have bath, you go to the gym and have bath. What is happening when you're excessively washing yourself? You end up removing or stripping away the natural moistures. and that leads to really dry skin. Then you have decreased water intake, so you're not hydrating yourself well, you're not drinking enough water. That can also lead to really dry skin. And then after that, you have your diet, you're not eating well, you're having a lot of deficiencies. You have deficiencies like vitamin A deficiencies, vitamin D deficiencies, vitamin E deficiency. All of this can lead to dry skin. Not just that, Samyukta, you have other conditions like if you're suffering from psoriasis, which is an autoimmune condition, you end up naturally having dry skin. Then you have atopic dermatitis. Atopic dermatitis is another autoimmune condition where you end up having really flaky, dry, hyperkeratotic or dark skin or pigmented skin all over the bodies, or sometimes even in pockets. All of these are genetic conditions which can lead to that. Right. Other than that, we also have conditions like you're taking treatment for acne, and that leads to your doctors prescribed you a lot of acids to reduce the oil content. That leads to dryness. Not just that, I see a lot of patients who self-medicate themselves. They say, "Yeah, ma'am, I have acne. I've been using salicylic acid." I'm like, "How? Like, how can you use it even without the doctor recommended? Somebody on Insta, somebody on social media recommends, and people all start following that, but they don't understand the repercussions of it. Just because somebody says salicylic acid, you end up having really dry skin, irritable skin. That is also one of the reasons for dry skin. Other than that, if you're taking certain medications like you're on diuretics, you're taking oral retinoids, either for acne or for other issues, you end up having a lot of dry skin. There are occupational hazards, like if you're exposing yourself to a lot of chemicals and irritants, that causes. So there are various factors, Samyukta. It's not like, there is one particular reason why one can have dry skin. It can be
Right.
environmental, it can be, certain conditions like autoimmune conditions, it can be lifestyle changes. So, all of these can contribute to a person having dry skin. I hope I'm able to give a little bit of insight into dry skin.
You have put it so beautifully, Doctor. Even you have cleared so many of my doubts about dry skin and the causes. And I'm sure it will help us to understand the problem. As you said, dry skin is one of the major reasons, or, it looks like various factors which can lead to dry skin. Moving on to the very important topic of this session, role of moisturizer. So there are so many causes which can lead to dry
I
skin.
think I
Is
forgot to also
moisturizer the
add
one-stop
aging.
solution?
I'm sorry, I think I forgot to add aging.
Sure.
So,
Yeah.
like I said, as you start aging, natural moistures in the body are not there anymore. It's not supple, young skin. So that we see a
Mm.
lot of adults in geriatric age group coming to us saying that they're having excessive itching, pruritus all over the body, and they have dryness, uncontrollable dryness. And poor guys, poor patients, like they come to us and saying, the only relief that I'm getting for this dryness is by applying a lot of hot water. But what is happening with it? More moisture is going away and they end up having dry skin. So yes, aging is one of the factors that I missed out, and I want everybody to understand that yes, aging can cause excessive dryness.
And is moisturizer the one-stop solution for all these problems? At least if you start early and use moisturizer on a regular basis, routine basis, make it your skincare routine, then are we supposed to have better skin health?
See, no doubt about it. Okay, moisturizing is something that doctor should not recommend. It should be part of your lifestyle. It should be like brushing your teeth. You wake up, you never stop brushing your teeth, right? It's a part of your routine. You never stop combing your hair, you never stop washing your face. Then why stop with moisturizers? So, what most people or patients don't understand is moisturizing is not something that is done only when you have dry skin. Moisturizing is a lifestyle modification, like I said, like brushing your teeth. Finish your routine, apply moisturizer. But again, the confusion here is people do not know what moisturizer they use to use. A lot of people end up using over the counter available moisturizers, which do not really solve any of their problems. It's not sufficient to take care of their extreme dry skin. So that is when they usually approach the dermatologist, only when it is extreme. Otherwise, you have zillions of moisturizers available over the counter. Everybody is moisturizing. They come to us saying that yes, they usually tell us about the top brands that are available and say we are using this and this and this product, and still I'm having dryness. But whether do these products have the right ingredients? Not everything labeled as moisturizer is going to moisturize your skin, right? So that is where we come into the picture and guide the patients to use the right kind of moisturizer. It's not just about using moisturizer, it's how to use moisturizer, when to use moisturizer, and which moisturizer to use is the key.
Fair enough. So, how to use moisturizer, when to use moisturizer, the right formulation, right ingredients, it all matters. Now, doctor, because market is flooded with products, plus as you also mentioned, there are so many influencers and people love talking about skin, and most of them are not qualified dermats. They just love talking about skin, and they are actually recommending people to use chemical peels at home, which can be really hazardous. But then people are falling for it, and we are experimenting with a lot with our skin in terms of products and all. So we have moisturizers over the counter, we have moisturizers from various cosmetic brands, etc. And we also have medicated moisturizers. For example, if I have a normal skin, no worries, then it's okay. But for example, I have any skin related issue, even if it looks like a normal dry skin issue for me, what is your advice? Is it a good thing to go and consult with our dermat to, help us finding the right kind of moisturizer as per our skin type, skin issues, etc.? Are medicated moisturizers more beneficial than these, so-called custom-made or tailor-made or these over-the-counter products, moisturizers?
Definitely, Sayukta. I would say please consult your dermatologist, because as dermatologists, we have studied what type of moisturizer suits what skin type. So if you have acne prone skin, I wouldn't give you a very greasy moisturizer that would clog your pores. I will give you something very mild. I would probably give you a gel based one, which is non comedogenic. That is something that does not cause acne. If you have excessive dry skin, then I would probably also give you something that contains a little bit of urea, something that melts your upper skin layer or dead skin layer, so that the moisturizer penetrates in deeper. If you have normal to combination skin, I'll give you a very light moisturizer for your face and something a little stronger for your body. So we have various factors to weigh in. We consider a lot of factors before we even recommend a single moisturizer. The problem with the moisturizers that are available over the counter is it is almost like it suits all body skin types. That's what most of the moisturizers have been labeled saying it is suitable for all skin types. What does that mean? How can every skin be the same? My skin is very different from your skin, right? Some skin tan very easily, some skin get dry very easily. So we have to focus on individual needs. We have to taper it down, or we have to make it tailor made for one patient. Not all moisturizers suit all. So it is very important for the patients to come to us, even if it is a simple dryness. They need not have dryness where your skin is breaking open and you're bleeding. Just simple routine. Even for routine, what moisturizer to use is always better when it is recommended by your dermatologist than just going ahead and applying what is available over the counter.
Right. Right. Another, you have also, mentioned it or taken up the topic, the problem with people who have a oily skin or acne prone skin. They will altogether skip the step of moisturization because they feel that, my body is already producing so much of sebum. What is the requirement of using a moisturizer? Is it true, or do they also need to use moisturizer on a regular basis?
See, frankly speaking, it is not a must and should that a person with acne prone skin should use a moisturizer, because, like you said, they already have oily skin.
Ah,
Like I'm continuously emphasizing, what type of moisturizer they have to use is very important. If I give them a very strong moisturizer, it is only going to complicate the existing acne breakouts. Right, so it is very important that I give them a light based, non fragrant, hypoallergenic, as well as non comedogenic, something that does not cause acne. It's very important. Why is it important for people who have acne to use moisturizers? Is because these people who have acne are taking treatment, right? And one of the major, or one of the first line of treatment for acne is to reduce the oiliness. When we reduce the oiliness, or we put them on oral isotretinoins or oral retinoids, or even topical treatment for acne, all of these end up causing a lot of dry skin. And for them, definitely moisturizing is important. People who are not on treatment, who are already producing excessive oil or sebum production, it does not make sense if I already give them moisturizer on an already oily skin. So I will have to be very selective in the moisturizers that I give. Whether I'm going to give them an occlusive, whether I'm going to give them a humectant, or whether I'm going to give you an emollient. There are various different types of moisturizers for different skin types. So based on that only I'll be able to recommend. Yes, it is not, to answer your question, it is not 100% needed for a person who has acne to use a moisturizer, but it's always better they use the right kind of moisturizer. It is not like they should not use it at all. It is better to use it, but what you use is very important.
Right. Usage of moisturizer is important, but more than that, what kind of moisturizer you are using, what is your skin type, what is your skin disorder, etc., it plays a more important role. Doctor, there is one more thing. The kind of society we are in, we are so obsessed with home remedies, DIYs, and we love using, say, coconut oil, mustard oil, aloe vera direct from the plant, direct from our terrace garden in case we have itchy or, flaky skin. So, malai, because it's winter and many a times, people will use malai on their skin. As a doctor, what's your take on that?
Okay, as a doctor, I wouldn't recommend it. Okay, so the reason, so when you talk about malai or cream or something that comes off the milk and apply it, we really don't know how sanitary it is. Okay, so there'll be a lot of bacteria in it which are there in the milk for different reasons. Yes, lactic acid does play a role, but a very insignificant role when used, directly from milk. So malai is an absolute no-no. Any types of creams, please don't apply it on your face. Coconut oil, see, we Indians have grown up with using coconut oil, either for the hair or for the face or for the body. Coconut oil has its limitations. It does not really penetrate into your skin. It makes it slippery, it makes it, very oily, but it is not enough to treat dry skin. And I'm a little scared with coconut oil, especially for elderly patients. A lot of elderly patients, even in the bathroom, they use a lot of coconut oil because they have naturally dry skin because of their age. I get so scared with these elderly patients because I'm scared that they may slip and fall. So I don't recommend that at all. When a patient who is, in the geriatric age group, above 60, 70, when they say they use coconut oil in the bathrooms or on a regular basis, I absolutely tell them don't. Because they may end up falling and having, fractures, which is even worse than having dry skin. So, no, it is not recommended to use home remedies. Please do not experiment. Please, coconut, eat it. Malai, eat it. Whatever you want to apply on your skin, please eat it. It gives you enough amount of vitamins and nutrition. Please do not apply it. There's a reason. Food is meant to be eaten. So please
Right.
consume it and do not experiment by using it on your skin. It is not safe. There are no scientific studies that say it is good. Please don't use it.
Absolutely. And doctor, we normally focus on our face when it comes to skincare, but not on our hands, even neck, legs, and these are the body parts. Even if exposed, we are not paying much attention to them. The same with moisturizer. We may moisturize our face on a daily basis, on a routine basis, but we tend to neglect, especially hands, because we are washing it quite often. But we are not moisturizing it that often, and many times we see, signs of aging on our hands much before we see it on any other part of our body, even if it's on the face. So,
Yeah.
my question to you is, what to focus on? I mean, if especially if we have this dry skin issue or dry skin, skin type, then what body parts to focus, and also when to apply, how many times to apply moisturizer? What is the right, way of putting it on?
Okay, so when we talk about other body parts, yes, we do focus on our face because that's what, we all, are seeing each other and we are very judgmental creatures as such. But like the face, even our hands and feet are the ones that are maximum exposed to sunlight, to the environment around us, to pollution, to the weather, right? So let's not differentiate the face and other parts. All your body parts require enough amount of moisturizers. Like I said, the same moisturizer that works on your face will not work on your hands and feet. The reason being, the skin on your hands and feet are very different from that of your face. The skin on your face is very delicate, it is thinner. But whereas your elbows, knees, buttock areas, even your feet and hands are very thick. So, of course, you need a little stronger moisturizers. And we are obsessed with hand washing. I think everybody after Corona, after COVID, we go and wash hands much more than we used to before. So, every time you wash your hands with water, your natural moistures get stripped off. Every time you use a detergent or a soap, it causes a lot of dryness because of the chemical irritation and the irritants that are acting against your skin. So when your hands are exposed to so much damage through water or through chemicals, definitely it'll need a little bit more moisturizing than the face, right? So you have to use stronger moisturizers for your hands and feet and the rest of the body part as compared to your face. So when patients come and ask me, ma'am, this body lotion that you've recommended, can I use it for the face and body also? Most of the time, yes, if it is a mild one. But if you have recommended a very strong one, please tell them not to use it for the face. They can end up having irritation on the face. But the same moisturizer, which is strong, will not cause any irritation on the skin that has very thick skin, on the body parts that has very thick skin. So, preferably tell them no, don't use it for your body part, but you can use it for your face or vice versa. So, guide them. Your patients have come to you to ask for your guidance. So be able spend enough time with your patients, telling them what to use, which area to use, how often to use. Now coming to what kind of moisturizer to use. Like I said, you have moisturizers that seal the already existing moistures. Those are called as occlusives. So be careful about what patients you're going to give this to. These are very greasy, which have to, kind of lock in all the moistures. Then you have emollients, which draw water from the outside. Then you have humectants that are naturally softening your skin. So all these are there to, kind of be very specific to certain skin types. So guide your patients which is suitable for them. And how often to use it? I would recommend morning and night because that is practical, that is convenient. If you ask the patient to use it multiple times, say every time you wash your hand use it, every time you go out and come back use it, it is not practical. Patients are not going to use it. They'll be like, ma'am, the whole day I'll end up just moisturizing myself. So tell them, yes, twice a day is more than enough. But if they have really problematic skin, like if they have psoriasis, if they have atopic dermatitis, or if they even have eczematous conditions or xerosis, generalized xerosis, they have to use it multiple times. 2 times is not sufficient. They have to use it 3 or 4 times in a day. Why? Because they have the need to use it. Otherwise, 2 times a day is much better. And if you ask me how long should one use moisturizer, it is a lifestyle modification. You have to use it as long as you're alive. Like as long as you're alive, you brush your teeth, use your moisturizers as long as you're alive. So I hope that answers, most of your questions. If there's anything specific, I'm happy to explain.
Definitely. Another very important thing that people often, miss is the temperature of the water that they are using for bathing, or, because hot showers are another very in thing, even if it's not winters. Uh, what is the
So,
impact of hot showers,
yeah,
or,
so this,
what
as
should be the
soon as
ideal
the patient,
temperature of water when
so
we are
yeah,
bathing?
so what I do, Sayukta, is whenever a patient comes to me, I write it down for them. So the first point that I always write down for a patient who comes with a lot of dry skin is have short, infrequent baths. So keep your baths very, very short. So I would say time themselves. I would say 2 minutes bath or even 3 minutes bath, not more than that. So when I say 2 to 3 minutes bath, they end up having 5 to 10 minutes, irrespective of how clearly you've told them. So make it shorter and scare them. Say them, you put a timer and then go in to have bath. That is the only way you can ask the person to reduce their exposure to unnecessary water. See, most of us are not doing, going out and working in pollution where we need to scrub ourselves. So just
True.
entering the shower and exiting is more than enough. Second thing that I point out or write down in the prescription itself is make sure you use lukewarm water.
Hmm.
They cannot possibly use very hot water. Absolutely not. See, I cannot tell the temperature, but the skin
Right.
should not start, having redness, and, fumes should not be coming out of your, bathroom. Just keep it very lukewarm water. Once you get adjusted to this temperature, no, you'll end up using the same temperature. You will not end up using very hot water. I know it's very relaxing. It's very tempting, especially in, winters, standing under the shower for minutes together and pouring yourself with hot water. I would say no, no, no. Okay, keep it very short, infrequent, lukewarm water bath. The third point that I write down is mild soap. You cannot use very harsh soaps. Something that is very colorful, something that is extremely smelly and fragrant, I discourage. So a lot of people say, I don't use soap at all. I use only body wash. But what kind of body wash are you using? Are you using that is, something that is very colorful and smelly, citrus, pumpkin? What not flavors do you get these days? I
Right.
would always discourage my patient from using. Keep it simple. Use a very simple, either a doctor recommended one or over the counter one also, that is not very irritant causing. Okay. The
Right.
next point that I say is absolutely no scrubs.
Okay.
I say, see, even when I say no scrubs, they say, no, no, I don't use scrubs. I use only loofah. I don't use loofah. I use a cloth. All of these are scrubs. These are, mechanical,
Right. Ultimately, we are
it's
scrubbing our skin.
absolutely no, no. We do not require any scrubs or cloth or anything to, take away the dead skin layer. Whether we want it or not, our dead skin layer gets shed away within the next 14 days or 21 days maximum. I would say just use your hand. For human skin, our hand is more than enough to remove the dead skin layer. And when patients don't agree, I usually tell their attendants, throw away that scrub that is there in the bathroom. So if they have a loofah, until and unless they throw it away, they will not stop using it. And I get a lot of patients from, villages. They are happy using stones, pumice stones, normal stones, regular stones. They feel they are not clean if they do not use it. But
Hmm.
what they do not realize is they're causing more harm to the skin. They're causing frictional dermatitis. They're causing, amyloidosis. So many other problems arise because of, using a lot of scrubs. So an absolute no-no to scrubs. The fifth point that I emphasize on Sayukta is fat drying their skin. I see a lot of people walking out of the shower, taking a nice, turkey towel or a cotton towel and nicely scrubbing themselves off. That is almost like scrubbing, right? So I say just wrap the towel around you, pat dry, wait for all the, wetness and the water to get absorbed from the towel, and then that's enough. And the sixth most important point that I put a star against it is Use a moisturizer within 3 to 5 minutes of having bath. What it will do is it will lock in all the moisture that you've just exposed yourself to while having bath. It will seal it in. So it is very important to educate and bring about this awareness to the patient, saying that please don't, wait for half an hour or, 1 hour. They say, yeah, ma'am, after bath, I do apply moisturizer. But when do you apply moisturizer? Apply it immediately after bath. So I recommend that the patient keeps a moisturizer in the bathroom or in their, shower area itself. The minute
Right.
they dry themselves, immediately, apply moisturizer all over the body, and that really helps. And this is a lifestyle modification. I tell them, almost all patients who come to me for dry skin, I tell them that is the treatment. These 6 points are your treatment. The whatever I'm
Yeah.
giving you moisturizers is just, temporary fixes. So if you want
Yeah,
to
I
have
think in
long
these
lasting
6 points you have
moisturizer soft.
actually, right, right. In these 6 points, you have actually, some of the whole vast topic and the issue of dry skin very well. The comment section is getting flooded with questions from our viewers. I'll take them one by one. So Sonia Sahu is here, and her question is, do moisturizing prevents aging signs?
Definitely. Definitely. Your skin, if it is, not moisturized, you're going to have a lot of wrinkles. And your body needs, your skin needs moisturizing and, humidity to keep it all supple and intact. Yes, it reduces fine lines, it reduces wrinkles. It also reduces early aging. So if you have good moisturized skin, even when you're in your 40s and 50s and 60s, you look a lot younger than people who do not moisturize regularly. That is not a myth at all. That goes without saying. Moisturize.
Okay, so Arish has here, and the question is it true that sunscreen moisturizers are enough to treat dry skin?
Depends on your skin type. So if you have acne prone skin, I usually don't recommend one extra moisturizer. If at all, we do get wonderful sunscreens these days which have added moisturizers in it. So with people with really oily and acne prone skin, I say enough, just don't, use multiple products. Just use the sunscreen which has a moisturizer, and that's enough. But if you come to me with really dry skin, I say layer the moisturizer first and then use a sunscreen. So be very selective in whatever recommendations you're giving. It has to be tailor made for that person.
Right. Leela Verma is here. Her question is, can you over moisturize and clog your pores with thick creams?
Yes, yes, you can. If you do not have really dry skin, if you have normal skin or mild dryness, if you're using a moisturizer that is too thick, that is occluding everything, you'll end up having more problems. You're going to end up having, acne in areas where you do not want acne. You'll have acne on your arms, on your back, on your chest. So you have to be careful about what type of moisturizers you use. That's what I'm repeating. There are creams, there are lotions, there are gels. So be careful about what you are using on which body part. Please figure out your skin type, and you cannot figure it out, unfortunately. You're not aware of, how the skin works. So please go to your dermatologist. They have done the studying for you, so they will be able to guide you and tell you, okay, use this, don't use this, or use this in certain body parts, not on your face. So all that guidance will be given to you by a dermatologist. Sayukta, are you there? I think there's some connection loss, or I don't know where. I don't see Sayukta at all.
Hello,
Sayukta,
doctor.
hi.
I'm so sorry. There was some technical glitch.
Okay, okay.
So, doctor, now to sum it up, any take-home message for our viewers? Anything that you would like to, as do's and don'ts, repeat before we conclude the whole session?
Like I said, my 6 points are very important. Okay,
Right.
so I would like to repeat it very quickly. So, short and
Sure.
frequent bath. Make sure you have lukewarm water bath, mild soap and detergents to use, non fragrant, nothing too colorful, no scrubs, pat dry, and apply moisturizer within the next 3 to 5 minutes of having bath. This is something that every one of us should follow. This you don't need a doctor's advice for this. This is a lifestyle modification. It really helps. Yes, moisturizing is required for each and every one of us, depending on your age, depending on your skin type, depending on your body part, depending on your environment, depending on your internal skin condition. You have selective moisturizers for your skin type. So please go to your dermatologist and make sure they look and examine your skin first and then recommend you the required moisturizer. So these are the
Right.
few
So,
points that I would like to emphasize on. Other than that, if there's any particular questions, I can answer. Otherwise, this is the take home message.
right. There's this one question by Rahul Bhatsawal, and the question is: does applying moisturizer at night make it even more effective? Because you said, we apply moisturizer just after taking bath. So, is it important to apply it at
It
night? Is
doesn't
it more?
matter day and night. But what happens when you apply it at night is you go to bed. You're not moving around, you're not exposing yourself to pollution or the environment around you. So, yes, the advantage of using the moisturizer at night is definitely more. But that does not mean just because you're applying it at night and not in the morning, you have better benefits. It's just common sense. That's nothing more to that.
Right, right. It was wonderful talking to you, Dr. Seema Srinivas. You have made this whole session so informative, so enlightening for us. It's a simple moisturizer, right? But it looks like so much. It can do so much if we choose the right moisturizer, apply it in the right way, and choose the right one as per our skin type, as per our skin conditions, etc. And now we know for that we can go to a dermat, contact a dermat anytime to get the better advice. Thank you so very much for joining us, doctor.
Thank you so much, Sayukta. You've been a fantastic host. It's really
Thank
nice to
you.
have met you. Hopefully, we get to do more programs like this in the future.
Sure. We really look forward for many more such sessions for our viewers in coming times with you. Thank you, doctor.
Great, Sayukta. Take care. Have a lovely day.
You too, doctor. Thank you. And it was indeed a very informative session. And this was issued in public interest by makers of Lulibo Lotion Advanced Gen X, a division of Hetero Healthcare. Viewers, thank you for your active participation in today's session. Stay connected to our channel. Do not forget to subscribe, like, and comment on our YouTube channel, Radiance with You. Thank you and have a great evening ahead. Goodbye.